Welcome to class. Today we're going to be working on some gentle hip mobility and continuing to make that connection with rib flare and pelvic mobility, that connection of the thoracic spine with our pelvis. A little bit lighter on that. I want to focus a little bit more on the hips specifically. And focusing on the hips specifically because I'm dealing with some hip stuff. I have a history, 5 knee surgeries on my right knee. I've only had 1 on my left knee. Right knee is constantly unstable, but the interesting thing is it's my left hip that tends to be the one that's wound up and gets tight. And I've been getting this kind of pinch anterior medial part of my hip, front middle of the hip. That kind of progressively gets worse. The more I move through the day, it seems to continue to help it. But this is an old pattern. So I'm going to try to talk through that a little bit more just to kind of talk about how I deal with these kind of issues and how the movement practice helps mediate. Doesn't fix, it's not a cure, but it helps to prevent it from getting worse. So managing it is really where I'm putting the most focus. So with that, let's go ahead and get started. Starting on our back, getting into our crocodile breath, making our nice big C shapes with our hands. Hands go below the ribs, above the hips, in that nice meaty section of the abdominal wall. Take a nice inhale through the nose, imagining that we're inflating the balloon or the crocodile of our abdominal wall. Feel that pressure pushing out into the thumbs, palms, and index fingers. As we exhale, drawing the navel up and into the spine, and allow those hands to cinch down to create that resistance for the next inhale phase of our breath. We're going to get a good 5 to 10 nice slow inhale and exhales. And as you're doing that, feel that pressure pushing out on that inhale and start to notice how well does it expand in all directions. Can you feel it pushing into the thumbs, in the back? Can you feel it pushing out through the sides into the palms? Can you feel it pushing into the index fingers in the front? Can also notice the shoulders. On that inhale, do they want to tense up and kind of round to the ceiling? On that exhale, can you just simply let them release and relax? Don't try to push them down, just try to let them soften to the floor. I want to think of this breath practice as kind of an activation of that abdominal core related to our breath. And once we get to about 8 to 10 breaths, we're going to now bring an ankle up to our knee. We're going to do some light figure 4 hip mobility. So I'm bringing my left ankle up to my right knee. I want to continue with that same breath through the abdominal wall, but we can now let our hands kind of relax down to the side. I'm going to switch legs. I'm going to go right leg so you can see it a little bit better in the camera. So from here, I want to actively reach my knee away from my body. I'm moving away from my head towards my feet. As I exhale, as I inhale, I'm bringing my knee back up to my head. Just doing some real gentle mobility with the hip. Light reach away, inhale as we bring it back. As you're reaching away, if you want, you can add your hand and just slightly push. Don't push hard. I want to feel that kind of mobility at the level of the deep hip socket. Again, inhale, release that hand, let it bring back. Exhale as you lightly push. Once we do about 5 up to 10 reps of that, we're going to go ahead and switch legs and do the same thing on the other side. So now it's left ankle on right knee. Inhale, knee can kind of come towards the head. Exhale, reaching that knee to the wall at our feet. This one's a good one to notice. How does it feel on the left hip compared to the right hip? My right leg was actually tighter in the sense that my knee did not sit as low, but my left hip, I actually feel tighter when I add my reach away. And I'm going to show that here in a second once we get through our reps. If you want to add that hand as you exhale, light push through the knee. Inhale, release the hand as the knee comes back to the head. So real quick, I'm going to kind of show what I was talking about. When I bring my right knee up to my left, or right ankle up to my left knee, my right knee sits higher. It's closer to my head. It's harder for me to get that knee to drop down. This is my 5 surgery knee. This hip is a little less mobile in this particular position. However, when I bring my left ankle up, my left knee sits lower, but when I actively reach away, it is significantly tighter in the hip. Much more noticeable, kind of not pinch, but just doesn't want to go as well. So kind of want to pay attention to those imbalances between the hips. We're going to come back to our first side. So bringing right ankle onto left knee again. Now we're going to pick our left foot up off the ground and pull that knee towards our chest. As we exhale, inhale, we're bringing that foot back down to the floor. If it's difficult to pick that foot up, you can grab your ankle or your knee with your hands and help to pull. And you're just pulling lightly to the chest. Inhale as we're letting it back to the floor. And as we pull, I want to see if we can feel that stretch mobility in the back of that hip. Once we get about 5 reps, we can add another little layer to this. That knee reaching away that we just did, we can actively reach that knee away as we pull our opposite foot to our chest. You can even place a hand or an elbow lightly on that knee and lightly push as the opposite leg is pulling. This might feel a little bit challenging, and if you find that you can't do it, then just pulling that opposite leg up is going to be fine and adequate kind of as a starting point. We're going to go ahead and switch sides, bringing that left ankle to right knee. And again, just starting with bringing that knee up towards the chest. Inhale as we let the foot back down. Again, if the legs feel heavy or difficult to get off the floor, you can use your hand to pull lightly. And again, I want to notice, how does it feel on this side? How high are you able to go? Is there a difference in the range of motion? Does one hip feel tighter than the other hip? Interesting thing is my left hip feels looser on this particular movement than it did on the previous one. Now, as we get to 5 reps, we can add that actively reaching that knee away to the wall at our feet as our opposite knee pulls towards our chest. And again, we can use our hands to help assist. I can put a hand or an elbow on that knee as I'm pulling in to help push that knee away at the same time. Again, this might feel difficult and confusing. If you're getting that knee pulling into the chest, that's a good place to start. We're going to switch back to our first foot, ankle on the knee. Now we're going to do some rotations. So with that ankle on the knee, I'm going to rotate my hips to the opposite side, see, as if I'm trying to place my foot flat on the floor to the opposite side of my body. I'm not worried about touching the floor. I'm only going as far as I comfortably can, and then I'm bringing it right back up to center. I want to keep our shoulders on the floor as we do this. We're doing a nice exhale as we rotate. If you're able to touch the floor with the foot, great. If not, you're just going as far as you comfortably can. Again, nice exhale as we rotate. Inhale as we bring it back. And once we get about 5 to our 5th one, I want to rotate as far as we comfortably can, not going to pain. We're going to stay in that rotated position, and then we're going to come back to that same knee, reaching it away as we exhale, inhale as we're bringing it towards our head. If you're able to place that foot flat on the floor to do this, great. If the foot is off the floor, that's okay. The movement of that knee does not need to be big, but that should create some interesting mobility at the front of the hip. Once we get 5 of those, we're going to bring it up and switch to the opposite side. So again, now got left ankle on right knee. Shoulders are soft and remaining on the floor as our hips slowly rotate towards the opposite side. Again, as if you're trying to place that foot flat to the floor. Inhale as we bring it back up to the center. Nice exhale as we slowly rotate to the floor. Again, how deep you go with this rotation is going to be dependent on how your mobility and not going into pain. I don't want this to be painful on the back or on the hip or on the knee for that matter. Once we get to our 5th rep, we're going to reach as far as we can. And now we're coming back to that kind of wagging of the knee, moving it towards the head on our inhale and exhale as we reach towards the wall at our feet. Again, want to notice the difference on the right hip and the left hip. I feel this significantly more on this left hip in that same area that I felt with our first movement when we were doing this on the original part of the figure 4. Although it feels like it's starting to loosen up a little bit. We're going to come back up to center. We're going to bring both feet to the floor. And now we're going to come up into a V-sit, getting into a nice wide V-sit position. In my V-sit, I want to see it get as wide as we possibly can, comfortably. Actively reaching the knees straight down to the floor, actively pulling the top of the feet back towards the shins. It's like you're trying to touch the top of your foot to your shins actively. And again, knees are actively pushing down to the floor. Hands come to the hips, behind the hips. We're reaching, grounding through the palms. I want to get as tall in the spine as possible. Elbow pits are going to spiral out and away. I'm going to get sideways on this. So I don't want to be overly rounded. I want to try to push and spiral the elbow pits out so that the shoulder blades pack down and back, and I get as much opening through the top of the chest. You might even feel some stretch in the chest from that position. From here, we're focusing on our hips still. We're moving from our kneecaps. We're going to turn our legs in like we're trying to touch our kneecaps to the floor on the inside of the body. And then we're going to open up, spiral out as if we're trying to touch our kneecaps to the outside of the body. And our inhale is going to be coming to center. We're exhaling in both directions. Exhale as you rotate inward. Inhale as you bring it to the center. Exhale as you rotate outward. Again, try to keep the knees actively reaching into the floor and the top of the foot pulling to the shin. And notice, how does this feel on the left hip compared to the right hip? Is one side tighter, more restricted? Do they go as far? You can, again, look at the kneecaps. How far in do both kneecaps go? Does one kneecap travel further? How far out do they go? Does one kneecap not travel as far? When I'm doing this, as I internally rotate, I feel almost like a pinch like not a hard pinch, but a stopping point pinch. I get stuck in my left hip faster than I do in my right. And when I externally rotating out, I get a bigger stretch on that left side. I don't get it as much on the right side, and I have more mobility. So this is that issue I have in my right hip or left hip, and it's more through the adductor, this inner front aspect of the hip compartment. Now we're going to add in some ankle circles to this. So as you spiral the knees out, we're going to point the toes, and then we're going to spiral the knees in, and then we're going to pull the toes back towards the shins. So we're doing our continuing to spiral through the kneecaps, but then that's also going to make this nice circle motion at the ankles. Now I want to pay attention to getting any kind of cramping or Charlie horse in the arch of the foot. So if you feel that, kind of back off, make the movement a little bit smaller. If you're able to add more to this, then we can start to flex the toes lightly. Again, I want to watch out for that Charlie horse effect in the arch of the foot. And then as we pull, see how much you can spread your toes wide as you're making that nice big circle. It's more of a point and flex as we push away, and it's a spread as we pull. And then we're going to reverse directions of that circle. We're going to go the other way with it. So as we turn inward, then I'm going to my point, bringing it out as I bring it back to the pull. I like to feel this kind of flossing effect through the ankles, which can be really good as far as like, especially if you get tightness and tension that creates some neuropathy where it pinches on nerves. We're also getting some deep hip mobility. We're going to stay in this V-sit. Now we're going to bring our hands off the floor, and we're going to do a little bit of light forward folds. It's going to get into that back line of the legs. So it's a nice inhale as we're tall. Exhale as we let those hands slowly slide forward. Inhale, we're bringing it back up. I like to think of this one like waves moving up a beach on that exhale, and then receding back into the ocean on the inhale. And I want that inhale to fill up that abdominal wall, still breathing into that crocodile breath, gets the spine nice and tall for that next exhale. And as I'm doing these folds, I want to try to maintain that nice tall spine. So as I fold, I don't want my spine to round. I'm not trying to drop my head straight down to the floor. I want to stay tall and just simply let those hands slide forward. And if you're only able to go an inch or two forward from that position because you got a lot of tightness and tension, that's fine. Let that be the end range and just keep moving into it. Slowly and slowly, we'll get a little bit further and a little deeper into it. And to finish this off, we're going to start doing a little bit of side to side, moving off of that center line, reaching to the right side, and then slowly reaching to the left side. Now, as I'm turning, I want to try to keep my hands and my shoulders together. So as I turn, my shoulders turn with, so that my hands still move the same distance related to the shoulders. I don't want one hand reaching further because that shoulder's naturally turned further. Turn the shoulders, hands reach even. By moving side to side, you're probably feeling this a little bit more isolated, one side hamstring to another. This, again, a good place to compare. How does the back line of the left leg feel compared to the back line of the right leg? Now, I'm noticing a rotational difference between sides. I can turn better to my right leg, and I can reach further. And when I go to my right, I have a bigger stretch and the left inside of that left leg. When I come to the left side, it is not as easy. It's harder for me to turn fully. I got a little pinch in my back. This just feels more challenging.
And it's largely in this left side. I don't feel it in the right side on this side of the body. So again, these are some of the kind of like symptomatic issues I'm having with that left hip and leg compared to my right hip and leg. I feel that left hamstring, especially lateral hamstring, more significantly tight on this left side. All right, so now we're going to get into our shin box position. So making that nice box with our shins. I'm in my left side shin box. Left hand comes down to ground to the floor. Weight is shifted over. I want this back hip to be free from the floor. I'm not trying to keep it on the ground. And we're going to start with our knee openers. So moving from this back knee, inhale into our crocodile breath. Exhale as we slowly lift that knee up to the ceiling. Inhale as we bring it right back down. I want to keep this lift slow. I don't want to go fast. I don't want to be forceful. I want to lightly squeeze into it. Inhale, bringing it back. Notice how high does this knee travel and how does it feel in the hip? I can feel nice little stretch through this groin area. You might feel it through the groin. You might feel it more to the outside front of the hip, or you might feel it in that glute space as a pinch. All of those are fairly normal places to feel it and are important for assessment. Once we do 5 to 10 reps, we're going to slowly windshield wiper across to the other side. Grounded palm, shifted weight, working on that back hip. So nice slow lift of that knee. I feel like my left knee is moving pretty close to the same range as my right, but it feels significantly tighter. And it's significantly tighter through this inner thigh, groin, front of the hip space. Since I feel that tightness and tension, I'm not trying to force it, but I am lightly squeezing into it on that exhale, and then inhale, bringing it back down. I got a little bit that I'm feeling in more on the outside front of the hip. And once we're done with our 5 to 10 reps, we're going to slowly transition back to the other side. And this is where I want to start to bring in that rib and pelvic connection. So we're going to place our hand on our bottom 12th rib on the back side hip. So my right hip is in the back, and I got my hand on my right rib cage. And this is where we're going to get into that hip mobility with that back hip. Our inhale, I want to imagine it's got weight to it, and that weight is going to drop into that back hip bowl, reaching that hip to the floor. So we're seeing if that hip can come down to the floor on the inhale. As we exhale, we're letting that hip lift up, move forward, and lightly scooping into it. So again, inhale, hip finds the floor. Exhale, the hip lifts up off the floor. We're reaching that hip forward, and then we're actively trying to scoop. And the way I like to think about that scoop is if your sacrum was a palm of your hand, your fingers would be your tailbone. And so I want to slide those fingers like we're trying to touch the wall in front. Now, we got our hand on that rib because I want to feel what that rib is doing as we scoop and as we unscoop and let that hip drop. So on our inhale phase, as we're letting that hip drop to the floor, we should feel that hip or the rib moving away from the hip. Really, it's the hips moving away from the rib, but since our hand is on the rib, we're going to feel the rib lifting away from the hip. As we exhale, lifting that hip, moving it forward and scooping, we should feel that rib moving towards the hip. And again, it's more the hip moving to the rib, but because we're touching the rib, it should feel like the rib is moving to the hip. So I want to see if we can feel that sensation of that rib moving related to the pelvis. Notice how tight does that hip feel, especially on the scoop. If you're able to feel tightness in that scoop, see if you can squeeze into it a little bit more and get a little bit more range and a little bit deeper stretch without forcing it and without going into pain. And then we're going to switch and do the same thing on the other side. So again, grounded palm, elbows spiraled out. We've got a nice solid packed shoulder with a tall spine. Hand is on our back rib, which is now my left rib. Inhale, allowing that weight of that breath to fill up that bowl of the pelvis. Exhale, hip lifts up, moves forward, and actively scoops. And I want to notice the difference in this hip compared to the other side. This is a much more challenging position for my left hip than it was for the right hip on the opposite side. And again, in that same area, I really struggle on getting as much scoop. I'm able to get pretty close, but it feels like it's a little bit limited compared to the other side. It's hard to feel that glute. I can feel the glute contracting, but it's not as strong as it was on the other side. So now we're going to come back to that hand being on the rib and feeling the relationship of the rib to the pelvis. As that hip drops to the floor, it should feel like the rib cage is moving away from the pelvis. As we exhale and scoop, it should feel like the rib is moving towards the pelvis. And really, that rib is kind of staying in the same spot. So what we're really feeling is how the hip is moving related to the rib. But again, the sensation is that rib is being pulled to the hip as that hip scoops, and that it's moving away from the hip as the hip drops. Once we get our 5 to 10, we're going to slowly transition back to the other side, keeping that hand on that lower rib. And we're going to do the exact same breath into that hip and exhale into the scoop, but we're now going to add some rotation. So as you inhale, fill up that back hip bowl. Exhale, that hip lifts, scoop, reaches forward and scoops. And now I want to turn my shoulder, my right shoulder, towards my right knee. I'm really, it's almost like I'm trying to touch my shoulder to that right, specifically to the direction of that knee. Exhale as you squeeze into it. Inhale as you allow that breath back into that back hip bowl. Exhale, that hip lifts, scoops forward, and then turning that shoulder towards that knee. Now I still have my hand on the rib cage. I want to come back to assessing that rib and how it's moving related to the hip. So as the hip drops, rib should feel like it's moving away from the hip. As we exhale and scoop, rib should be moving towards the hip. Now, as we rotate, I don't want the rib to move away from that hip. I want to feel that rib continuing to be drawn towards the hip as I'm turning my shoulder. And this is going to be a really subtle distinction, and it might feel difficult to kind of get a sense for. So if you're struggling with this part, focus on that scoop, focus on the rotation. We'll get to this next layer soon. If you're able to feel that relationship well on this hip and pelvis relationship, as you scoop, if that rib is rotating out and away, that means you're getting a lot more rotation from this level of your spine. And I want that rotation to come from more evenly through multiple segments, not so much just from that T12L1 junction. So if the rib is coming out and away, that means we're getting hypermobility in one spot. If we can feel that rib moving more towards the hip, even as you rotate, that rotation quality is going to be coming from some of the lower vertebrae a little bit more evenly. We can do the same thing on the other side. So we'll slowly rotate across, ground that palm, opposite hand is on the opposite hip. Inhale into that back hip bowl. Exhale as we actively scoop, feel that rib moving towards the pelvis, and then adding that rotation, moving that shoulder to the knee. Now, part of the reason I want to have that hand on the rib as we go through this is you may find that you can feel, number one, feel that connection on both sides, and you might be able to control it a little bit. Or you might find that one side you can control it and the other side you can't. So when I'm on the other side of my shin box, I got pretty good control of that right rib. But with this left hip and my left rib, as I actively scoop, I can feel that rib drawing in a little bit, but then when I apply my rotation, it takes more effort to keep that rib moving to the hip. It wants to float away. And my rotation on this side is so much tighter. And it's tighter specifically at that T12L1 junction. So this is that relationship. Tight hip creates some tightness in the spine as well. So this is one of my big issues right now. And it's not something I can cure or fix because I have true instability in my right knee. I don't have a PCL ligament. I've had 5 surgeries. It's not going to just magically fix. So these are things that I have to learn to manage. We're going to switch back to the other side, and now we're going to get into our folds. So with our folds, we're going to continue to kind of move through that knee. I'm going to bring both hands to each side of that knee, and I want to push into the floor and try to square my shoulder. So I have even pressure through both hands and both shoulders are square to the floor. And I want to try to keep my sternum through the arrow of the knee. We're going to take a nice inhale into that back hip. As we exhale, we're lifting that hip and scooping. Again, I want to get that active scoop in the back hip. And then both hands are going to lightly slide forward as we try to keep our sternum moving through that knee. Inhale, we're coming right back up into that back hip bowl. Exhale, that hip lifts, moves forward, scoops, and then we continue to slide forward into our reach. Notice how smooth does this movement feel as you go into that scoop and into that fold. And then as you're reaching, where do you feel it? Do you feel it more in the front of this back hip? Do you feel it more in the back of this front hip? Do you feel it in your low back? Maybe you even feel it some in the shoulders. Does one hand want to slide further than the other hand? Is it hard to keep that sternum in line with the knee? Does that sternum want to kind of roll away from it because your body just doesn't want to sit upright on this very well? We're going to switch and we're going to do the same thing on the other side. So again, bringing that knee, hands are coming equal distance to that knee, pushing into the floor, finding that nice square position. And right off the bat, this is a good assessment point for me. I got low back. I can feel it tight as I turn into it, and I feel that left hip a lot more on this side than I did on the other side. So we're inhaling again into that back hip bowl. Exhale as we let it lift, reach forward and actively scoop. And then continuing to exhale as we try to move that sternum through the knee. This side is just simply a lot more challenging for me. This left hip feels tighter, more restricted, specifically in that front space. And as I get into my reach in my rotation, I feel that, oh man, it just opens that left hip up a whole lot. and I feel it a little bit in the right side low back. But as I do these movements throughout the day, this generally gets a lot better. Yesterday this was really sensitive early in the morning. But I kind of spent a good amount of time yesterday working on it. By late afternoon, early evening, I barely noticed it. Obviously, it's still there. It's still an issue. But I'm going to make the assumption that if I'm able to get significant relief from it because I'm able to get it to move better, that means I'm putting less stress on the hip compared to if I did not do those movements. If I didn't maintain this practice, all this congestion in this hip would get worse and worse, and I would probably be looking at a hip replacement a lot sooner. Now we're going to start going back and forth through our or through our folds. And I'm less concerned about reaching through the arrow of the knee and getting so perfectly square. Now we can just kind of do a general explore. We can reach forward through the shin. You can reach through the knee. You can even explore a little bit beyond the knee. But whatever we do on one side, we're going to do a nice little windshield wiper transition to the other side to do the same thing. Nice exhale as we fold. Inhale as we come back up. Exhale as we start our transition to the other side. Inhale as we finish our transition. Exhale into our next fold. And we're keeping it nice and slow as we go side to side. By going side to side, we can really get a good comparison of how it feels on the left hip compared to the right hip, or really the left side compared to the right side. And we're going to do a good number of reps here. This can be 10 up to 20 reps. Once we get a good 5 reps in, we're going to start to change the angle of our shin box. So as we get to one that's our starting side, we're going to let that back leg slide open just a little bit. And then getting into that nice, slow, comfortable fold. When we come back up, we can slide the knee back in, go to the other side. And whatever position we did with the other side, we want to find that same position on this side so that we can continue to compare. And all of these, everything on this, when I go to my right side, I feel it a lot more in this left hip. And with each one, we're going to continue to slide that leg open a little bit more if we can. We're just playing and exploring with different positions of the hips in the shin box, and we're slowly kind of moving it towards what we would consider that yoga class pigeon pose. Right. When I get into these more open positions, it puts a lot more stretch into that left hip in different angles that really seem to help mobilize it a lot more. And for our last few, we're seeing how much can we reach that leg back without forcing it. I don't want to go to pinch or pain, but we're seeing how much can we get out of that, reaching through that leg, getting into our fold. And how does that feel moving from the left side to the right side? Side's a little bit tighter. Tighter in my right glute, as well as that same area front of that left hip. So the interesting thing here with the folds is It's not just this inner thigh, it's also the outer thigh on the opposite side. So I don't feel it as much in the right hip, but I do feel it a lot in this left one. But the two are related to each other. And so it's working in this right hip that helps with the left hip. It's working with the left hip that helps with the right. All right, we're going to change our position. We're now getting into our inverted sit position. So knees are bent in front, hands are coming down to the ground at our hips, grounding through the floor. We're going to start with some basically an inverted cat-cow. I want to start with the elbow pits or arms. We're doing arm spirals. I'm turning those elbow pits in towards the body as far as I can. That's going to start to round the shoulders, round the upper back. And then we're going to externally spiral those elbows out in a way. And as we do so, lightly push down into the floor so that you feel your chest lifting up to the ceiling. Exhale as we spiral inward. Feel that nice rounded upper back. Inhale as you spiral outward, getting nice and tall in the spine. Now we're going to start to add in our pelvis. As we exhale, spiraling in, shoulders rounding, also allow that pelvis to scoop a little bit so that we can get some stretch into the low back. As we exhale, pelvis is moving forward as we get nice and tall in the spine. See how much can you get into that upper back and lower back together on that exhale. And then as you inhale, getting tall, turning those elbow pits out and away. Can you feel some stretch across the top of the chest? Kind of feel your sternum lifting up to the ceiling. On your next inhale, as we get tall, we're going to stay tall. And at this point, we can cross our legs in front if that's more comfortable. But I want to stay in this tall. Elbows are more spiraled out. Chest is as open as we can get it to the ceiling. And we're going to do a little bit of light neck mobility. We're going to start with checking our blind spots. So nice inhale into the nose. Exhale as you slowly look over your right shoulder. Inhale as you bring it back to the center. Exhale as you slowly look over your left shoulder. Notice how well does this feel looking over that left shoulder compared to the right shoulder. For me, turning to the left, tighter, more restricted than turning to the right. Right feels fairly free, but my left feels like it is a little bit more of a challenge, not as smooth. Once you get about 5 to 10 reps, we're going to come back to our starting point, and now we're going to get into glides. Now, glides are going to be really challenging, especially if you haven't done them before. The idea with the glides is I want to try to keep our cheekbones on the same level, and I want to keep our face square to the front. If you have a mirror or a camera that you're looking at, that can be helpful. What I don't want is for the head to tilt to where my cheekbones go into different levels, or that I turn my head and rotate. So I'm trying to keep my face completely forward facing. I'm going to inhale. On the exhale, I'm gliding my head across towards my left shoulder. Inhale as I bring it back. Exhale as I glide towards the right shoulder. Now, again, this is a super challenging movement if it's new. It's not unusual for the head to turn and tilt. We're trying to prevent that as much as possible to get this smooth action gliding back and forth. You don't need to go as far as I'm going. However far you're able to go and control and keep that face forward is where we're starting from. And this is a good one to notice. Can you move better when you go to the left than when you go to the right? Is one side harder to do? Is it tighter, more restricted, or are you more likely to turn and tilt in order to get that movement all to go as far? And I don't want to push so far that you turn or tilt. So limit it to precision. I want to keep the face forward as much as possible. Good. So next, we're going to get into our light tilt and lift. So as we're lightly letting that ear drop, I don't want a full drop. I'm not trying to touch my ear to my shoulder, just lightly tilting. Opposite ear is lifting, like I'm trying to touch the ceiling with my earlobe. When I reach up, inhale as I bring it back down, exhale as I go across to the other side. And as I exhale and lift that ear, I also want to kind of actively press down through that same side palm. I want to feel that shoulder depressing as that ear is lifting. And again, how does this feel right side compared to left side? My right side feels, I can feel that palm is more grounded and I get a pretty good lift and it doesn't feel like a sharp stretch. My left side, however, it's harder to get my palm to ground. So I have some instability in this left shoulder. And I just don't get quite as much activation in that lift. It doesn't feel as connected. So I have some differences on that right side compared to the left side. Although as I'm getting into it, I'm starting to feel a little bit of balance between the two. I'm able to get a little bit more into that left side. It's still not quite the same as the right. All right, so we're now going to change positions and we're going to get on to our back. So I'm going to use a yoga block, placing it between the knees. You do not have to use a yoga block on this exercise, but I find that it is helpful in order to keep the knees square together. And the knees need to be square in order for keep the hips to be square. We're going to let our arms, we're bringing our knees up, feet are off the floor. Knees are around 90 degrees. Hips are a little bit less. I want to bring the hips in so we're a little under 90 degrees. That should help keep the low back a little flatter to the floor. Arms are going to come out to the side with the palms up. This is where I like to imagine we're laying in a bed of sand, and I want to get a nice imprint of my upper body, shoulders, elbows, forearms, wrists, fingers. Everything's grounded, pressing down. And the imprint in the sand is the most important part of this exercise. I don't want shoulders to slide and move around because that's going to mess up my print. So I have to be really well grounded and not let anything move from the upper body. From here, we're going to let the hips rotate to the left, but we're only going as far as we can without letting our arms and legs or our arms and shoulders slide around on the floor. Exhale as we go to one side, nice and slow. Inhale as we come to the center. Exhale as we go nice and slow to the other side. Now coming back to my yoga block. As I rotate, so at the top, I should have a nice tabletop where my knees are perfectly square. As I rotate, I want them to remain square to my hips. I don't want them to remain square to the ceiling. If we don't have that yoga block, it's not unusual for one knee to start to trail behind to where they're no longer square together. That means that hip is trailing behind and it's not actually rotating. So you're not going to get as much mobility in the low back. Part of the reason the yoga block helps is because we're bringing our knees together, so it helps to keep those knees in alignment. And when they come out of alignment, it becomes more aware because we're not holding that block square. So see if you can maintain those square knees. And you may notice that you're able to go further in one direction than you are in the other direction. My rotation to my right is more limited and tight and restricted in my left side low back than my rotation to my left. I have a lot more mobility going to my left, a lot more control of it. Going to my right, a little bit more challenging. Again, keeping those shoulders perfectly square to the floor. I don't want that shoulder to get pulled up off the floor. If it is, that means you're going too far. And once we get a good 5 to 10 reps, we can bring our feet back down to the floor. And I want feet to be nice and flat with the legs bent. Arms can come down into a nice comfortable position with the palms up to the ceiling. We're coming back into our breath, and we're going to do some pelvic tilts from the floor. Nice inhale. Feel that belly lift up to the ceiling. Let the pelvis tilt to the ceiling so that we get a nice sway in the low back. You might be able to slide your hand underneath. As we exhale, we're scooping our tailbone, and I want to feel that belly button. Imagine the belly button is a thumb, and it's trying to push your spine flat to the floor. Inhale, belly lifts up, pulling your pelvis forward, big sway in the back. Exhale, feel that belly button, flatten the spine as much as it can as we get that little bit of scoop. I want to avoid pinch or pain in the back. But without pinch or pain, I want to get as much mobility in that pelvis and spine as possible. So as we inhale, I want to feel that pelvis tilting up towards the ceiling as much as we can get it to go. Feel that belly lifting as much as it can go. As we exhale, feel that belly button really push down and try to scoop as much as you can. You may feel your feet get a little more engaged into the floor. As you're feeling those feet get engaged into that scoop, we're going to continue that scoop. And we're going to now start to peel our spine off the floor, starting at the sacrum. So inhale takes us into our anterior tilt, spine is off the floor. Exhale, feel that belly button drawing in, and then we're going to continue to scoop. Feel the sacrum lift off the floor. We're going to continue to scoop, and it's going to peel each vertebrae one at a time. I'm continuing to scoop until I get into a nice hip bridge position. And then I want to see if I can let each vertebrae down one at a time on the inhale, coming all the way down to belly lifting up, pelvis tilting forward. Exhale, navel in as we scoop back up into that hip bridge. I want to put our hands on our rib cage. I should have done that while we were doing our pelvic tilts. Notice as your hips come to the floor and your pelvis tilts forward and that belly lifts up. With that hand on the rib, ribs are moving away from the pelvis. The pelvis is moving that way. It's rotating up and forward. The rib cage is tilting up and back. As we exhale and get that scoop, you should feel your rib cage start to move down. Pelvis is scooping up, rib cage is moving down to the pelvis. And as we start to scoop up to the ceiling, lifting, I want to continue to feel the ribs moving towards the hips. I don't want the ribs to lift up away with the hips. If that is happening, it means we have that extension, a greater extension at that T12 and L1. So I want to feel pelvis scooping, rib dropping at the same time. And at this top part, as you continue to scoop, can you start to feel some activation in the glutes with that rib continuing to move down? On the inhale, as the hips drop down, you should immediately start to feel that rib lifting up and moving in the opposite direction of the hip. Once we do a good 5 to 10 hip bridges, on the next one, when we get to the top of that hip bridge, we're going to stay at the top. Again, I got my hands on my ribs. And now we're going to do pelvic tilts from this hip bridge position. So inhale, pelvis is tilting forward a little bit. Again, it's going to cause the belly to move up to the ceiling, and then we're going to get a little sway in the back. Our hands are on the ribs are going to move away from the pelvis. Then as we exhale, we're scooping back into it. We should feel the ribs moving towards the hips. Inhale, let that sway in the back, let that belly move up to the ceiling. Exhale, scoop. Can you feel the ribs moving towards the hips? This can be between 6 and 10 nice full breaths. By the time you get to the end, you should feel a little bit of burn in the glutes. Where we can then let the hips come back down to the floor. And we're going to finish now coming back into our crocodile breath to reassess and activate that core aspect of our breath. So again, hands below the ribs and above the hip bones. Nice slow inhale. Feel that balloon expanding into the hands. Nice exhale. Navel presses all the way down into the spine. Feel those hands clench in so that you can create that resistance for the next inhale phase. Again, notice the shoulders. If on your inhale, they kind of round and tense up, see if you can let them soften on your exhale. And I want to notice from the beginning of class, do you feel like you have a little bit better expansion in that abdominal core? Is it moving a little bit better than it did at the beginning? I got a decent amount better mobility in my breathing in that core part of my breath than I did at the beginning. Doesn't feel as tight and restricted. Get a little bit bigger breath in. We can go ahead and let the hands drop down, palms up, so that we can soften the shoulders a little bit more. We're going to continue to breathe into that abdominals, but we're also going to bring our breath into our ribs, chest, upper back, shoulders, and neck. Nice breath in. Let it fill up the ribs as well as the abdominal wall like a balloon. On the exhale, we're letting all the tension release into the floor. Inhale, we're breathing into tension. Exhale, we're letting that tension go. You can take a little scan of the body. On your inhale, notice if there's any places that it feels dense, tense, difficult to get that breath into. And just shine a soft light into that area, a little soft focus of your breath. On the exhale, see if you can let that tension melt into the floor. When you're ready, you can open your eyes. Very slowly come up to a seated or stand before you come up to a standing position to make sure that you're not feeling dizzy or lightheaded.